with my friend Nancy, who is my co-host for this episode. Hi, Nancy. The EELift is one of the newest procedures in cosmetic surgery, and we've got just the expert to break it all down for you. Dr. Ali Sharafuddin is a plastic surgeon who's joining us today. Welcome, Dr. C.
Hi, thank you for having me.
Thank you for coming on our show. Can you tell us a little bit about your background?
So I'm a board-certified plastic surgeon, born and raised in Lebanon. Did my training at the Mayo Clinic and the Cleveland Clinic, and I specialize in facelifting. I specialize in facial rejuvenation, and that's what I do every day, 5 days a week.
Facelifts only, or other procedures?
Facial
Which
rejuvenation.
Is amazing.
That's
yes.
The aging face. This is really my focus, and this is what I love to do. It was my first day as an intern, and I saw a facelift procedure, and I was like, this is really what I want to do. It was love at first sight, and continues to be.
Which his work is amazing. So he has created the EELift, which is the new face of facelifts. And for those people who aren't familiar with that, could you explain what the EELift is?
So it's a little background. Facelifts have evolved significantly, and we started doing facelifts in 1920 in Paris and France, and it started to evolve until 1974. There was a major breakthrough in techniques, and this is when we started to understand the SMAS and understand what's under the SMAS. And it's just a technical thing, but since 1974 until now, there's not a lot of major breakthroughs in the actual techniques. What have changed is the concept of rejuvenation, the concept of looking natural. Now, at Eden, we're taking the conversation to another level. You will rarely see me talking about techniques. We talk more about concepts of rejuvenation, and this is why the EELift is getting a lot of attention. We really think outside the box. Like it takes almost a year for a patient to get on my schedule for the procedure, and during that year, we prepare the patient and we study the patient, and we think about it as the aging signs that we see on the face are just symptoms of an aging process that happens at all levels in the body. And that's why we're looking, for example, at the genetic age of every organ in the body before we do the procedure. We're looking at hormones, right? Hormones are a big, have a lot of importance in the health of the skin all over the body. Now think about it, when a pregnant woman, right? Lots of hormones, skin looks amazing, looks shiny, her face looks amazing, right?
Yes.
And when you go through menopause and we start losing hormones, that also affects the skin, affects the face. So we look into that too. Now, what's also important is the kind of environment the patients live in. Are they exposed to toxins? Are they exposed to things they should not be exposed to? That can affect healing. And I've learned this really kind of the hard way. I had a couple of patients, the healing was not optimal, lots of swelling, they were uncomfortable. And I have a friend of mine, a functional medicine doctor, we're talking about these things. And then we test them and we find pesticides in these patients. They traveled from,
that's interesting.
Yeah, they live on a farm. My wife, we tested her, had arsenic. She was losing hair.
Wow.
So now we have a filtration system in our apartment to make sure that we're not drinking arsenic water. So there's a lot of things we do to prepare the patient to get the patient into an optimal situation to get the EELift or the facelift. Now, from a technical standpoint, and this is really the point fort of the EELift, is I never offer the same procedure to patients. I never say, you're coming in, I'm going to do this facelift for you. It just doesn't make sense to me. There's 6 types of facelift or 7 types of facelift we can do, and it would be a shame. They all do great, and it would be a shame just to do one of them, right? Sometimes I have 2 sisters in one day, and they get separate different procedures. You can be You can do application, you can do a smastectomy, you can do a high smash, a low smash, an extended smash, a deep plane, a skin only. There's so many tools we can use. All these tools have been present since the 70s. Actually, Dr. Skog, he's a Swedish plastic surgeon. He was doing this reconstructive surgery on a burn patient in the face, and he discovered that there's this layer called he didn't name it SMAS. It was another surgeon who named it SMAS, that you can lift up and move around to. He used it for reconstructive purposes, and this is what really ignited the SMAS facelift, or whether it's a deep plane or a SMAS. But I don't go into the techniques of the facelift because each patient needs to get its custom-made facelift, and that's why when you go on my website or our books or the social media, you see hundreds and hundreds of before and afters, and it's very hard, or I think impossible, to find two patients that look the same.
Do you have a certain protocol, like a regimen, like how people to prepare? You say it takes a year. So is there like a protocol that people could go by to prepare themselves for that?
Absolutely. So the moment we meet and we decide on proceeding, and we have a date, let's say next year, October or whatever, we get the ball rolling. We start, and you start meeting with my nutritionist, with my functional medicine doctor. We get all the labs we need, all the tests we need, and the conversation starts as soon as possible. And we really started immediately. Yeah.
So you're doing like a heavy metals test? Are you testing the gut? Are you just, is it a
There's
big battery of
100.
tests?
I would love to have Dr. Labib one day with me, because
Yes.
he's much smarter than me, and he shows me these pictures and these graphs, and I look at them like, he's like, can you see this? Can you see? I'm like, yes. I mean, he tests so many things,
Right.
and he treats so many things.
Yes.
And Dr. Labib is my functional medicine doctor. He's the one. He's OBGYN by training. He does difficult OBGYN cases. He specializes in that. At the same time, he wrote 2 books on functional medicine, and he's into all of these tests. And soon we're going to be able to test the age of the skin. We don't have this technology yet, but in the next few weeks we're going to have it. And I haven't told this to anybody. We're going to start studying. You know how you mentioned the gut. You know how you have some bacteria in the gut, and they're really important, right? Well, guess what? We have a microbiome on our skin, and it's really important too. So we're going to be the first practice in the world to be looking at the microbiome of the skin in preparation also for the facial rejuvenation. That's why the procedure, the actual procedure, is the last thing, and it's really the easiest part of the whole process.
Because you're looking at the patient holistically from all angles, not just looking at, I need to.
It's just not one procedure.
No,
it's going to be everything
they're doing
together.
a lot of testing.
That's pretty amazing.
That he's the only surgeon, and I've met plenty that does this.
It's funny how you mentioned that, because I had an aunt. She had a facelift, and I guess they didn't realize that she has maybe the microorganism. She ended up swelling up and had a horrible reaction. She was on a test tube for about a week because she had some sort of bacteria infection. So that's important. Most surgeons don't look into those details, and you're amazing. You're looking at all the details.
He looks at everything. I went to his office because I thought maybe I needed something recently, and he told me to leave. So unfortunately, I can't use it.
I kicked her out. I said,
He kicked her out of my office.
What are you coming to do here?
I'm like listening like intensely, because I'm like, I think I'm almost there.
He's like, why are you here? And I'm like, because I had one 7 years ago, and I'm sagging.
Because she told me, she's like, you should have been like 2 years ago. I'm like, oh my God, am I too late? Am I too late?
And then we randomly ran into each other in Italy this summer.
Yeah, that's amazing.
No, it's amazing. But no, he's a great practice. And
it's never too late, right? It's never too late.
Well, a good surgeon's going to tell you the truth.
Okay.
And also, I tell the viewers, and it's in my book as well, when you're looking for a facelift surgeon or for tummy tucks, you want somebody that specializes in that one area, because like you're doing so many procedures per year. Like, how many facelifts do you do in a year?
We do at least, I do take a lot of vacations, but we do around 300.
Right, 300 is a number, because that makes him an expert. Right. He's specializing in the face. Otherwise, if he was doing tummy tucks or breast augmentations, that number would be reduced to probably 50, 60, or 100.
And you
That's
sound
true.
like you know
That's
your
true.
stuff.
I mean,
Yeah.
the usual practice is a practice that, look, plastic surgeons are some of the smartest medical students, right?
Yes.
And they want to do everything, and they want
Yes.
to do. They can do breasts, they can do noses, they can do tummy tucks, BBLs, all that stuff. And it happens that there's a few of us in the country who just want to do facial rejuvenation, and it makes it a very rare opportunity, right? It's I enjoy it every day, every case. I learn something every case. This morning I had this amazing man. He didn't give us permission to show his pictures. He's 77. And
Wow.
I mean, his life was absolutely amazing, and he's very active, and he lost some weight, and he has a little thing here, so we took care of it. So every single case is different. The second case I did, she's younger, of course, she's like 52. Nothing here, a few things here, and she's like, you know what? I don't want to go through non-invasive or minimally invasive procedures. I just want to do it. I want to be done with it and move on.
Right, so which is great. How do you feel about the endoscopic facelift?
So there's a lot of endoscopy. The world of endoscopy really started in the early 90s. And it really started in, I think, in OBGYN. When people started, instead of cutting the abdomen open and looking inside, they would put a little scope, inflate the abdomen with gas, and start looking around. Then people started taking appendix out, right? The appendix, the appendectomy being done laparoscopically. So that means putting a little camera after you inflate and you look inside. And then in the mid 90s, late 90s, people started talking about an endoscopic facelift. Now, the most common procedure that used to be done endoscopically in the face was an endoscopic brow lift, where people put a few incisions right here and they go in with the camera and then do stuff. Now, the next level is when they really come down to the face with the endoscope and work on the tissues. Now, when we talk about the brow lift, an endoscopic brow lift, standard procedure, very common, done for a long time. I don't need the endoscope when I do my brow lifts. I just do them without the need of the endoscope. It's super easy to do without the endoscope. Now, when you talk about an endoscopic facelift, this is usually for the younger population, the younger patient who doesn't have much skin to be removed and who needs soft tissue repositioned.
Is it less invasive?
Yes, it's less invasive, but isn't there something that they use where it's like a giant thread? Almost.
Well, this is the threading is a whole other world. I'm not into it. I'm not big on it. I haven't seen very successful threads. But with the endoscopic facelift, it's just a facelift that doesn't remove skin. It actually repositions the cheek or the jowl back into where they should be. It's not a very common procedure because usually under 40, you have younger patient trying to get the cheeks up or something, But most of the facelift, I would say 99% of the facelifts are done with the open technique, where you really have to remove skin. Either you have to remove skin from here or remove skin from here. At the same time, you got to work on the inside of the skin, the SMAS and the fat.
So
and
it's
the
less
platysma
of
band
face
and all these
contouring.
things.
Yeah, so like for our
When you're
age
younger,
group,
you want face contouring, but when you're older, like us, we want
you
lift.
have excess skin. So when can I come back?
You're welcome anytime.
Can I get a group discount?
Well, we have to make sure, really, even if you're not getting a procedure, let's make sure that you're not exposed to certain toxins. Let's look at your hormones. Let's look at your
so I
genetic
can come
area.
back and be a patient for that.
Anytime. You're welcome anytime. So, and we're doing now little things. Now, there's so much technology out there, and it makes people confused. Right? It's really confusing. Every 5 minutes, you have a device coming up, and I have three devices in my office. That's it. A CO2 laser.
Yes.
This works.
Which
we know
love.
it works.
We
It
love.
works. There's no doubt about that, right?
Yes.
A microneedling device. It doesn't have to be with radio frequency. Any microneedling works. Mm-hmm. Now, look, there's a whole thing about microneedling. I'm not going to go through it.
Right.
And an IPL.
Yes.
That's it. That's all what you need. Now, whenever you hear something, when something sounds too good to be true, especially with a facelift, just be careful. Just be very careful. It took me years and years, me and all the other surgeons who do facelifting, years of practice, years of residency, sleepless nights, cadaver dissections, meetings, conferences, reading books, watching videos, training to be able to do this. When someone tells you, I can do this with you in 20 minutes and you're going to be fine, you're going to get a facelift, just be careful.
Yeah, I agree.
Just be careful.
There's a lot of research that needs to go into searching for the right surgeon. And I'm sure you have people flying in from everywhere because his waiting list is so long. It's minimally a year. I actually think it's a year just to get a consultation.
I'm not sure about the numbers.
I think so.
I think,
it's a long waiting list.
What I'm afraid
very
of is
lucky.
like, some people get into, like some doctors, they like a certain look. And that look may not look good on certain faces.
Yeah.
So that's some doctors, they don't know how to think outside the
like
box.
more of a signature
and
instead of a customization.
I sense that you are more of a customer.
Look, it's very simple. I mean, I think it's very simple. I look in the face, we look inside, we see how the aging happened, how this mass dropped, what's the best way to bring it up where it should be, and really trim the excesses. I mean, technically, it's really simple. I mean, obviously, I've done my 10,000 hours of expertise in this, right?
Yes.
So, but technically, it's simple, and there's no magic facelift, really. I mean, there's nothing. Like a board certified plastic surgeon with appropriate training should be able to do a really good facelift.
And
There's nothing.
what do you
really
do when you have like
imagine.
unrealistic goals? Like people come in
Yeah.
and they have
No,
unrealistic goals.
Thank you so much for this question. So I want every case I do to be a home run. Like every single case, I want it to be a home run. And this only happens if I can do what the patient wants me to do. If they're asking me for something that I cannot technically achieve, or if I can do and make them look really stretched like this, I'm not going to do it. So I turn down around 30% of the patients I see.
He turned me down.
Yes.
He said, get out.
That shows that you're a great doctor, and most doctors don't know how to turn.
I know, that's
yes.
why I said, he said, look, I have the lights on, I have a staff, I have to make money, and I still want you to leave.
Wow.
That's why I know he's a great
That's impressive.
surgeon.
So
He's very impressive.
you just vouched for us.
So it's really the expectations, and if they really need it. So like Sandra, you come in, I'm looking at you, I'm like, what am I going to lift? There's no lifting to happen, and you're rejuvenated. You look great. You look amazing.
Thank you.
But the other things, when people start talking about stretching the lips in order to get rid of some lines on the lips or lines around the mouth, this is where when I start like, okay, maybe I cannot do this case. Or expectations, expecting the surgery to get you a better role in a film or get you higher in your company or
look like somebody you're not.
or bring you back an ex-husband or ex-wife. No, really. I mean, I get
Or
this.
escape your past. Yeah, or escape your past.
That's so funny.
The procedure is a procedure. You're doing facial rejuvenation. That's it. This is where what I want to really do a home run every time. And there are things I can do and things I cannot do. And I keep it very, very simple.
So where can our viewers find you exactly?
You mean physical location?
Well, the physical location we know is in Coral Gables.
We're on Mercy, we're on Mercy
Okay,
campus. I love the hospital. We're on Mercy campus. We're in one of the professional buildings. Now, look, I can be anywhere I want in the world or in the state of Florida. I choose this because there will be this one patient who's going to get a Tylenol and get this allergic reaction to Tylenol, right? It's going to happen.
Right.
So I like to have peace of mind. I'm on campus, connected to the hospital. Knock on wood, never needed it, never used it. And I live in Brickell. That's why I like this location. I'm 5 minutes away from the office. Now, our recovery hotel is really on Brickell Avenue. So it's like 5 minutes away from where I live,
perfect.
5 minutes away from my office. Yeah. And on my evening run or evening whatever walk, I always pass by and see how the patients are doing.
That's
it's right under
amazing.
my house. So we have a nice ecosystem happening.
So for
here.
our
Yeah.
viewers who are watching,
Do you have a website?
yeah, he
for
has
us
a
to see your
website.
work? Mhm.
He has Instagram. The Instagram is the
Instagram
EELift.
is the most popular. The
Yeah.
Instagram is the most
Yeah, it's
popular.
all
It's
visual.
EELift_official.
Yeah, and we'll have all of this in the show
I'll be
notes.
checking
but
you out.
for the viewers, also,
Yeah.
whoever wants a facelift and can come to Florida, it's easy. It's easy.
They usually
stay.
come to Miami and the night
Yeah.
before, and then I see them in the morning, and we do it. They stay 7 nights in Miami. I tell them to bring a husband, a friend, a significant other to have fun, because
Yeah.
recovery is pretty fast and good. They take some Tylenol for some discomfort, and they have the famous the famous wrap, and they walk around Miami. Everybody knows they've been here when they see it.
It's like a badge of honor. It's
Does
actually a
the wrap-
badge of honor
Does
now.
the wrap say EELift on it?
It doesn't say anything, but they
Okay.
know. Like at the hotel, on the
That
Arca
would be
Hotel.
funny.
Like
No.
you know, it's funny because all my patients stay at the hotel on Brickell Avenue, and they meet each other in the morning or on
I
breakfast
love it.
table or whatever, and they become friends.
Yeah,
and they
this is
exchange
great.
numbers, and they Uber
Yeah.
together to come here. It's fun.
That's
a community. That's
Yeah, it's a
great. Yeah,
community.
wow.
Thank you so much. This was amazing. This was great information. I really appreciate you taking your time today to come on the show.
Thank you for having me.
Okay, thank you.
Thank you, guys.
Bye. If you like what you're hearing on Party's Over, do me a favor and share it with your friends. And please like and subscribe to keep our community growing. We'll be right back.